Hi friends, I wanted to hop on real quick and correct myself on something that I said last week on my first episode of my podcast, Learning as They Grow. I was discussing cesareans, C-sections, and said that I thought they cut through about 4 layers to get to the baby, but in fact they cut through 7 layers. So let's take a look at that, see what 7 layers they cut through, and just how serious of a procedure this is for moms to go through.
All right, so obviously they make the incision on the outside of your skin, and then right below that is the fat. They cut through that, and then you have the fascia, which is a connective tissue between the muscle and the skin. Then they get down to the ab muscle, and this they don't cut, but they do separate that muscle between the abs, which is why it can be hard sometimes to grow that back. Then they get to the peritoneum, which is a serous membrane lining that covers the organs and the nerves. This is why you'll feel nerve damage afterwards. Then they make the incision in the uterus. They move the bladder down. They don't cut that, but they do move it down. And then once they get through the uterus, they cut a little hole in the amniotic sac, and there's baby.